So here's the agenda. In a break from normality, we're going to have the vaccine booster update from Dr. Colin Spears and Eleanor, because they have to leave a little bit earlier. And then Steve Turnbull's going to give us a data update, followed by Gary Jevons speaking about Health Watch and some funding they've had. Simon was going to come and talk to us about the benefits campaign, but sadly is not able to join us today, but I do have a couple of slides. And then we're going to finish on a high note with Amanda, that's going to be telling us about some work of the Featherstone Rovers. So over to you, NHS.
Thanks, everyone. I'm Eleanor Nostra. I think I've met most of you before when I've been on these calls. So I'm the lead for communications and engagement for the West Yorkshire vaccination programme, of which Wakefield is a key part. We just wanted to go through it sort of a bit wider than just the boosters, actually. It was to make sure you had up-to-date information on the phase 3 that we're now in of the vaccination rollout. Hugely appreciate all your support and helping us get information out into communities and answer any sort of questions about it. So really important that we make sure you're all clear on what's happening, because the programme has become more complex, lots of changes. So we just wanted to run a bit like we did at the beginning, a sort of session to go through where we are now, the key sort of points to be aware of, and give you a chance then to ask us and Colin any questions you might have about the information. So just as a quick recap, you obviously started supporting us right back at the beginning. So that was in phase 1, which was the priority group. So these were the people who are at greatest risk from COVID. We started with, and they're what's called cohorts 1 to 9. And then we moved on to phase 2, which was where we started going down through ages of people under 50 in 10 years. And then this is where it started to get a little bit more complicated, because as more evidence has emerged, the Joint Committee for Immunisations and Vaccinations, who provide all the advice and recommendations on how the vaccine is rolled out, started looking at benefits to other groups. And so added into that was that all children from 12 and above who were at serious risk of COVID, or who lived with an immunosuppressed adult or child, should be offered the vaccine. And then also that it should be offered to all 16 to 17-year-olds, but with it being slightly different in that they were offered a single dose. We do think that's a change, and there's likely to be a recommendation now about them having a second dose, but again it was put forward as a let's get one dose, keep reviewing the evidence and see if that's needed. So where we are now from sort of September is phase 3. So obviously that does cover boosters, that's a big part of it, but the other 2 areas that you may be picking up questions about and that are key focuses are the third doses for certain severely suppressed people, and the programme of offering vaccines to all healthy 12 to 15-year-olds. So boosters, so it's literally is one of those, does what it says on the tin. It's about boosting the protection against a particular virus or disease, in this case COVID-19, but you'll be familiar with this. It's not just COVID-19, this happens for other vaccinations such as tetanus and polio, although that's obviously a larger gap. And this is in response to the evidence shows that the levels of protection start to reduce over time from those first 2 doses. So it's not a huge, rapid decline, but it's enough to have quite an impact on the number of people who may need admitting to hospital, and even increased risk of death. And as you'll remember, that's what the vaccination programme is all about, trying to prevent those 2 things. So I think the key things to sort of really note about it is the recommendation is that it's best for people to have this at least, well, it is 6 months. This is sort of what's called the sweet spot after having your second dose. And that again is based on all the evidence from the trials and reviews that has shown that that was the time to give, that gave the maximum boost to protection levels. And that for this one, the recommendation for boosters only, the recommendation is that it should either be Pfizer or Moderna. So it's what's known as the mRNA vaccine. So these were the ones using the slightly new technology. And again, that is because the evidence showed that no matter which vaccine you'd had first for your first and second doses, these gave the biggest boost to immunity. So in terms of who needs it, and I'm saying needs rather than eligible, because one of the things we really want to get across is that people do need this, and it's important they have it. It's back to those 9 priority groups that were at the start of the programme. So, you know, particularly care home residents and staff, people who are, well, the term used to be clinically extremely vulnerable, didn't it? But it's now high risk from COVID-19, frontline health and care staff, people, and basically everybody over 50. So it will, by virtue of the 6 month, it will sort of automatically follow the original order, but there will be somewhere people are getting it at similar times. I think the thing to note as well is that where people are, I think this was cohort 6, where you were at increased risk from COVID. This also included ones not just from health conditions, but sort of other lifestyle factors. So for example, homeless people, asylum seekers and so on. So we'll be working to make sure they are all offered booster doses as well, and unpaid carers fall into this category. So in terms of getting one, it's when you reach that 6 month point, everyone will get an invitation from the National Booking Service to say they're eligible and asking them to make an appointment. And people may also get an invitation from their GP practice. It's the same sort of prioritised by cohort as before. We start with the 6 month and then it is working through in priority. And on the National Booking Centre service, you can book your appointment choosing a convenient centre. You now have the option of doing that slightly earlier. So though the 6 month gap is still when the booster will be given, you can actually, once you reach 5 months, go and book ahead. So that would mean you could literally have your booster on the 182nd day after having your second. So it's a way of making sure it's booked in for people and to try and get people through as quickly as possible. Thank you. So these were the bits I just want to sort of draw your attention to. And again, you know, you may well already be aware of this, but the programme, there has been some changes to how we're doing it since we started the rollout. So this isn't actually true in Wakefield. I think Sarah was reminding me that all the GPs are taking part in it, but nationally and across other parts of West Yorkshire, not all practices have had the capacity to be part of the programme. There's obviously, you know, you'll be well aware there's a huge amount of pressure on general practices to get back to pre-pandemic sort of service levels, more people face to face, and also we're very conscious that demand's increased. So there's a lot that practices are having to deal with, and where people felt they couldn't manage all of that as well as boosters, that not all practices are doing it. So with that in mind, we, as well as sort of increasing choice, we've brought in more community pharmacy centres. So Wakefield does also have quite a number of new centres and pharmacies that have come on board for the booster programme, again to help us reach people as quickly as possible and as they become eligible. And for other areas where some of the practices have had to opt out, that wherever possible we've tried to marry those up with communities where they won't have a GP service, to make sure there's still one as local as possible. So it's just so you're aware that there may be some differences in other areas, or, you know, colleagues, the way we were talking across West Yorkshire is slightly different. So the other bit is about the booking on the National Booking Service. We've all got very used to that now, working in the programme, but obviously at the beginning, that wasn't how it worked. People were just waiting to be invited by their GP. So certainly for some of the older patients in this group, that will be a new thing for them to use, new system. They won't not be so familiar with that as people in later groups. And again, at the beginning of the programme, we weren't offering walk-ins, it was all bookable, but you'll be very aware that as we moved into phase 3, the walk-in offer became a really key part of it. And we're now back to, for Wakefield and other areas in West Yorkshire, is about booking appointments. That's what we're wanting people to do. Again, it helps manage with the 6 month gap and make sure people can go through as quickly as possible and ensure that we can reach all people who need a vaccine, whether it's their first, second, third, school offers, or this very important booster. So we've talked about the 6 month gap and the fact that the difference is about these vaccines, that it's only the certain ones that are recommended. So for some people who had Oxford, the other change that they'll see is they will need to wait for 15 minutes after having their booster. And this is back to the guidance at the time that for these vaccines, there is a 15-minute observation sort of wait, just to make sure there are no allergic reactions. Very, very few, but it just means that people have that security of knowing they could get help if that was needed on site. So what we're really wanting to get across to people, and you may be able to help us with, is please book as soon as you get your invite, or as soon as you're eligible. And don't wait. You can have the booster with your flu jab. It's perfectly safe, and at some places you'll be able to do it, but not everywhere, because flu jabs, it's a very different type of vaccine. It can be provided at individual practices, which the COVID vaccines can't, due to their storage requirements. So what we don't want people to do is think, oh, I'll just hang on and see if I can get them both together. We really want, whether it's your flu or your booster, to go as soon as you can. And similarly, not to wait for an invitation from your GP, because that may take longer. So if you can book it on the National Booking Service, please think and look and see if you can find a centre that's convenient. As we were just talking about, change for quite a lot of people, particularly in the earlier priority groups, is that this will mean they may go to a different place. So it won't necessarily be where they had their first or second dose. And we really want sort of asking people not to contact their GP unless they've received an invite, asking them to book an appointment, because it is again about waiting for GPs, clinics to be set up and invite you to. The importance of people getting a flu jab is a really key one that we're trying to get across as well, particularly that from the last couple of years with the lockdowns, the flu hasn't been quite as serious, and we don't think people will have built up the same levels of immunity that naturally happens, haven't been as many cases. So more than ever, it's just as important people get their flu jab, and nearly everybody who's eligible for a booster will also be eligible for a free flu jab too through the NHS. So moving on, so the third doses. So this is quite a complicated one, because it really is all about the individual. It takes it much back to their specific needs. It's not a blanket approach. So this, unfortunately, because it's at the same time as the boosters, you can see why people sort of get confused, and it is a third dose, but this is not to boost immunity. It's recognising that for certain people, they won't have got the same levels of protection from the first two jabs due to their condition or the treatment they were having. So it's not for everybody who's immunosuppressed, it's for those that were severely immunosuppressed. And this includes people who have HIV, leukemia, had a blood transfusion, and it was at the time that they were given their first or second vaccination. So that again is why it brings it more back to an individual approach, and that the timing of when you need that third dose will be determined by your condition and the treatment. So the way that was worked is, because it is such an individual approach, that consultants and GPs were asked to identify patients who met these criteria and need the third dose, and to contact them to arrange vaccination. Clearly this is a vulnerable group of people. We wanted to make sure everyone was aware of this. So the NHS has written to anyone who is immunosuppressed to say, you might fall into this category. But then that's left quite a few people wondering, is it just that I've not heard? Because what happens is the GPs are only contacting people if you do need one, rather than ringing you to say, well, you might have had a letter, but actually you're not eligible. So there has been a little bit of confusion around this, that you may pick up if this is relevant to any people that you're in contact with in your community. So it was just to try and explain that this has been a relatively complicated one, and that we're also looking at a way that people can sort of self-declare and go into and book an appointment at a vaccination centre, but that hasn't quite been finalised yet. So the other element of phase 3 is one that's attracted an awful lot of attention, as you will be aware, and that was the decision to offer the vaccine to all healthy 12 to 15-year-olds, rather than just ones who were at risk or living with an immunosuppressed adult. So this came from, again, this is a bit different. So this was based on a decision and recommendation from the NHS's chief medical officers. And recommended that a single dose is offered to all children in this age group. And it's slightly different because the JCVI's remit was to base their decision on the impact on hospitalisation and death rates. And they then said, well, this is our remit, but for this group, you might want to consider the wider health implications. And so this is what the chief medical officers looked at, and around the impact, particularly on mental health and well-being of the children were going through, where their education was disrupted, missing school due to either having COVID, isolating, lockdowns. And that's a large part of their recommendation. So it was, as I'll mention later as well, but this was all about the benefits to the actual children in this age group. They did not take it into account how it would benefit in terms of not spreading to other people or helping to reduce rates. It was all about the benefits to this age group. So they will be offered Pfizer, because that's the only vaccine so far that's been licensed and approved for this age group in the UK. And that followed extensive reviews of evidence and clinical trials in these age groups, both here and looking at what's happened in other countries, who are also lots of other countries doing this. So initially, the offer was made in schools only. So it was all about working with the school nursing services to set up clinics in every school in Wakefield and wider across West Yorkshire. And then since half term, we've also been offering the option to go to an out of school clinic at one of our vaccination centres. So again, there are very specific requirements around vaccinating children. So it won't be at every centre. It's so that we can ensure the right staff are there who are very experienced in dealing with this age group and any sort of particular anxieties they may have around it, and consent processes. And still, after half term, we had a good, lots of people wanting to come and book. So we are continuing to run some clinics outside of school hours. So sort of evening 4 till sort of 8 seems to be a common pattern, or at weekends. So that if parents, for example, would feel more comfortable coming with their child while they have the vaccine, they can do so as well. But we hopefully by the end of November, I think it's slightly earlier in Wakefield actually, but all schools will have had their clinic. It's been quite a juggling act, as I'm sure Sarah will have mentioned, because obviously there've been outbreaks in schools. We couldn't, if you've had COVID, you then have to wait 28 days. So there's been a lot of sort of factors that have had to take into account, and clinics that may have needed to be moved on occasion to accommodate this. But the good thing about having the out of school clinics is any child that missed out on that day or was needed to wait for the 28 days can then get an appointment through there as well, rather than having to wait to see if we'll be able to be doing another clinic. And the clinics are also picking up vaccinations for children who are homeschooled. So we were looking at doing that already, and then now it's linked in nicely with offering it more generally. That's quite right, Tracy, we're coming on, you were right. So I guess about this one, some of the key things to note is, as we said, it was only about the benefits to 12 to 15. So it really was recognised, felt that this would be beneficial to them themselves. And the key word with this one is the offer. The emphasis has always been on that this is something that parents and children need to consider, read the information on and make their decision on. It is recommended for the reasons set out, but it really is recognising it. There is a lot of, the personal choice element of this, and that it's based, the whole approach is based on parents consenting. So certainly in schools, children will only be vaccinated if we have a completed consent form by the parent and guardian. And at the out of school clinics, we've also been asking parents or guardians to attend with the child, partly about consent, but also to go through the process with them and make sure they've understood everything. You'll probably have picked up there was a lot of sort of talk about GILIC competence. Now, this isn't just something that's been introduced for COVID-19 and COVID vaccinations. It's been, it's gone for a long time, particularly through school-based services and things like sexual health, recognising that some children are mature enough, have sufficient understanding to be able to give consent for them to have a particular treatment. But it is absolutely key to ensure they understand any implications of that treatment and are fully aware enough to sort of consider the pros and cons and make that decision. So it's something that is assessed incredibly carefully by trained health professionals. It's not a quick process at all. So that might take place at a vaccination centre if a child presented without a parent or guardian, but most likely they would be asked to come back with them if that was possible. And then alongside this, we are looking at what we will be doing to make sure that as children turn 12, they can still get their vaccination, because we won't be able to go back into schools, keep going back and back to pick up everybody as they reach 12. So we're looking at how we will make sure that those children can get their vaccine as they reach the right age. So I've now hopefully covered the sort of the key points, and you'll have had a chance to read the pack that we've sent out. This was designed to sort of go alongside the one you've already got. So it is more about the sort of operational sides of this, but still links back to a lot of the sort of concerns that people may have had that may be the same for this. And what we were wanting to do is, as before, listen to what your questions are, see what we need to add to that, and keep adding to it, and keep the dialogue going about issues that are coming up, concerns, and what we can do in terms of providing you with information to help reassure people and encourage them to have whatever they're eligible for. So I'm hoping Colin's joined us. I can't actually see Colin on here, but in terms of asking questions, Tracy, I can't see people's hands up and things. So are you able to?
I can't see any hands up, but we have got a question in the chat from Amanda, which is, if someone has had both jabs, but antibody tests have shown no antibodies, should they have a booster and they are not immunosuppressed? Great question.
I'm really hoping Colin's on.
Hi, can you hear me?
Yes.
Yes.
So sorry, I've had technical problems. So my understanding is that if somebody has had antibody testing done, has been tested negative, and should they have a booster? Well, unless they fall into the eligibility criteria for those that have been deemed to need boosters, the answer would be no. That a lot of the tests that are looking for antibody status for COVID are not looking for antibodies generated by the vaccines themselves, but from some earlier testing that was done on looking at antibodies generated from exposure to the COVID infection itself. The tests that are done to look for antibody status in relation to vaccines are largely only used in university settings and research settings, looking at responsiveness to the vaccine. So there isn't a direct. Some people will show it will show for some, and others it doesn't, and there doesn't seem to be a very easy correlation between the two. So we know that looking at all of the studies that they've not found people that don't mount an immune the vaccines and on completing their primary course. So 2 doses if for most people, 3 doses if they were immunosuppressed at the time of the first 2 doses, will get the coverage that has been experienced in all of the studies before these products were deemed safe and licensed for use. And also all of the studies that have been done afterwards, where we've been looking at populations to see what's going on and how the populations are responding to receiving the vaccines. I hope that answer helps.
Yeah, it was the Office for National Statistics came and took a blood test, and when they got the results, it just said that they were negative for antibodies.
Yeah, so that's a population study that's looking at rates of COVID exposure.
Right. Okay, so they're a carer, so they will be receiving a booster. But I just didn't know whether, if you don't have immunity, whether a booster would boost your immunity.
It may never be detected in the blood tests.
Yeah.
But there's no strand of kind of reporting that's showing that people are mounting no response to the vaccines at all.
Right. Okay.
So even those that are immunosuppressed were showing good levels of response, but not as high as those others. So not providing the full protection we'd want to offer them from hospitalisation or requirement to go into an intensive care unit.
Okay. Thank you.
Thank you. We've also got a comment in the chat from someone that's saying that somebody had gone for a booster appointment to Navigation Walk this morning, as she'd received a message from the surgery to book a booster, but she booked through the national booking system as they had got earlier and more convenient appointments for her. However, when she got there this morning, she was questioned as to why she was on the list, as according to them, she shouldn't be. She was definitely over 182 days since the last one. The guy on the check-in details desk on entry was quite funny about it and had to go and get permission for her to be allowed a booster. Then she was told that she needs to find out why she was on the list. They said there'd been glitches and they had turned people away. She said he wasn't unfriendly, but it did make her feel a bit weird and was quite awkward. And imagine if you were someone who wasn't confident or maybe older, would you want to go back if that had been a situation you were in? So that's just a bit of feedback.
Shall I just comment on that?
Yes, please.
Sorry, I'm Sarah Akers. I'm the Senior Programme Manager for the vaccination programme for Wakefield, and I can take that away separately, Anne-Marie, if you'd like. We are aware that there are some people who had their first and second doses back in the spring because they were a carer or because they worked in an organisation that is patient facing, but maybe not in the front line. And we were very good in Wakefield about making sure that where we had vaccine, we did get that vaccine into arms. But it does mean that there are a few people who don't strictly fall into the criteria now as being eligible. However, we're trying to be quite pragmatic, and we've asked sites to be quite pragmatic about this. And if somebody has gone past their 182 days and explains that maybe they're a carer, or they work in a healthcare or a social care setting, because they've gone past the 6-month trigger, then just get on and give that person their booster, because they're going to become eligible very quickly anyway. So it's really because we were quite quick off the mark back in the spring, and very good about making sure we didn't waste any vaccine, and we got as many people vaccinated who were moving into those sort of priority groups. But maybe weren't strictly falling into the priority group when you look at the national criteria. But Anne-Marie, if you'd like to give your contact details in the chat, I can certainly pick that up and take that away and discuss it with Navigation Walk if you'd like me to.
Thank you very much. I was also going to ask a question about unpaid carers that become eligible, because we did have some comments in previous meetings about some unpaid carers not being registered as such with their GP surgery, or the GP had said, well, it's a child you're looking after, so that's your responsibility, you're not defined as a carer. And I wondered whether that had all been sorted out now.
Yes, so long as people, you know, if a GP is saying, well, you're not a carer on that basis, then that's not correct. They just need to ask their GP to put them on the carer register, and then we can make sure that they do qualify.
And we are doing some targeted work around that, because in the first phases, when this cohort would have been vaccinated, we worked with local support groups in each place for carers, so that people could go to them and say, well, I'm not registered as a carer with my GP, but I do sort of qualify. And then they could, I think particularly in Wakefield, you were very good about then getting them registered as a carer, because part of this is about recognising that carers will get other support as well if they're registered as such with the GP, other than their vaccination, and that's really important. So we're looking at whether those arrangements will come back in, because there'll be some people now who have become carers that may not have been, so will be eligible even though they weren't declared as a carer then. And also still about trying to make sure those people are aware of the benefits to them, and how we get them through when they won't be on the system as a carer, and you know, that process. So we're just looking at all of that and going back to work with our very supportive voluntary sector colleagues on that at the moment.
Fabulous, thank you.
I know that
Wakefield District Carers did loads of work, didn't they? Yeah.
Colin.
Hi, Colin, lovely to see you.
Hi, thank you. I'd encourage anybody to register with Carers Wakefield, because we have an arrangement that in the background we pass people's details backwards and forwards between general practice and Carers Wakefield, so that we all have the same list of who are registered carers. So if you're having problems with your GP, and there is a very tricky issue around children, then you know, we'd be wanting people to register with Carers Wakefield as well, because of the other forms of support that they can provide, and they will pass the details on to the general practice.
Absolutely, thank you. I know they've got loads of people registering, which is fantastic news. Thank you.
Tracy, just slightly linked to this, slightly tenuously, but just to mention as well, one of the other sort of questions we've got about is people who are not registered with a GP full stop, so not just carers. And so we did have quite a few people who weren't, who still wanted a vaccine and will have been vaccinated, and who may then be eligible for a booster. So that we will have their information locally. Each place will have done that where they were vaccinated. So although they still won't be invited by the National Booking Service, because that does take everybody's details from GP records, we will still be individually as an area following up with them to make sure they don't get left behind either.
Ah, that's great. Thank you.
And
thank you very much. Do you have any more questions for our team here?
I wondered if it was worth me just very quickly sharing how well we're doing with the booster programme, just to give people a absolutely up-to-date position. So we know that this winter over 160,000 people in Wakefield will become eligible at some point for the booster. We've already given a booster to over 63,000 people in Wakefield, which is absolutely fantastic. So of the people who are already eligible for their booster, because they've gone past that 6-month trigger point, We've already given a booster to 60% of those people, and we know that many of them will have an appointment in the next 2 weeks, 3 weeks, at a time that suits them at a local location. So we're doing really, really well with the boosters. And just the bit of another interesting background possibly is that we've actually over the same time period, which is sort of 6 or 7 weeks now, we've given 80,000 doses of vaccine in Wakefield. So we're still vaccinating people with their first and second doses. We're still getting people coming forward for that first dose who've not previously opted to have a vaccination. So it's really, really positive. There's about 1,600 people every week coming forward, either to get that first dose or to get their second dose to complete their doses. So really, really positive progress in Wakefield. I'm not going to say that sometimes it's easy to get an appointment exactly on the day that you want, but we have got good capacity, and we'd really encourage you to encourage people to get booked on. Thank you.
Thank you. That's awesome news. And actually, a lot of our COVID champions, people on the call today, having conversations with friends and family. Some of them have done the vaccine hesitancy training so that they can help people to understand where the information is that's reliable sources. So great work as a whole team. Thank you very much for that.
Thank you.
Brilliant, thank you very much. Unless you have any other questions then, I think it's over to you, Steve. Steve Turnbull's going to give the data update and I don't have it. So are you able to share your screen, Steve?
Yes, I will. Just bear with me a second. Yeah, I'll try and move through this fairly swiftly, so I know we've got lots of other things to discuss. But yeah, obviously time for a few questions. So you're familiar with this chart, I'm sure. So this is the rolling average of our case rate. Most recent on the right hand side, you'll see that we've been zigzagging up and down over the last couple of months, really, at this relatively quite high level, around the 400 mark. We have more recently just started to come down. It's off the edge of the chart. This week's figures, alongside Yorkshire Humber figures, alongside national figures, have started to move in the right direction. We need to be careful and cautious about that as ever, for two reasons. One, that might represent people not wanting to get tested as often. And secondly, we've had half term, which has helped to slow down case rates in young people. They're now back in school. So we'll have to just wait and see what happens through the next few weeks. I won't go into detail on this. This is the regional picture, and slightly out of date now, but we were on these figures for over 400. What is probably more useful to look at is the right-hand burgundy column. That looks at the over 60s rates, and we had over 60s rates up towards the 300s, 275, and I'll touch on that in a couple of seconds. LFD tests, so lateral flow tests, these are the asymptomatic tests, the ones that we're trying to encourage people to take these twice weekly on a regular basis. It's holding up. We expected it to come down. The last big spike where people took more tests was return to school. And a lot of these tests are school kids. You can see the daily fluctuations in the blue bars. A lot of people get tested on Mondays, so you'll see the little spikes there. It has continued to slightly slow down, but we're still doing over 2,000 tests per day in Wakefield. So I think that's quite a good measure, that people are still trying to get tested and trying to control COVID. I'll skip over this, partly because my eyes don't differentiate between the colours very well. But this is positivity and the number of tests we're doing, and largely we across Wakefield district are mirroring what happens across West Yorkshire. We're tracking that quite well, which is useful. It suggests we're in the same kind of ballpark as our neighbouring authorities, and we're not diverting into higher rates. Testing by age group, again, it's been fairly steady. The big change is the green line. You can see that's the 11 to 16s. So again, going back to school, that meant a lot of people were becoming tested, and that slightly decreased over time. And then more recently, probably going back upwards simply because of the return to school after half term. When we look at case rates by age group, we see the very different picture. So the blue line is the one that I showed earlier. It looks a bit different because the scale is compressed, but what you can see very clearly is the yellow line, which is the 5 to 10 year old, and the 11 to 16 line is the 11 to 16 year old. And this shows that we had significant outbreaks. Most recently, reaching twice, we went over 2,000 cases per 100,000 kids in the last 7 days. That was the inevitable, that when you've got a largely unvaccinated cohort of people and you put them together in with no mitigations other than ventilated classrooms as best they can, they're going to spread an infectious disease amongst themselves. So we've had that big spike. It's come down, as you can see. That's the half-term effect. We were very concerned about this pattern. So working with head teachers and our children's colleagues, we have asked school and advised schools just to implement a few more precautionary measures to try and slow down spread within school settings. So we're encouraging secondary schools to use face coverings and primary schools to use face coverings with the staff rather than the kids. And just to try and, if you've got, for example, you say you've got a child who's COVID positive and they have a sibling, keep that sibling at home. At the minute, they can come into school. Now, if they want to come into school, we encourage that. That's fine. We're not putting barriers up. But we have seen a number of outbreaks happen where a sibling has come into school and then they've tested negative, but then by the time they've shown any symptoms and come back positive on an LFT, they've infected their classmates, and then we see that steep rise. So we are reviewing that on a twice a week, a fortnightly basis, and we will roll back against those measures when we think it's sensible to do so. The other part of that picture is, of course, when you've got kids off school because they've got COVID, and we had lots of them, quite often they need looking after. And that means that we've had lots of health and care staff who are not able to go and do their job because they're looking after their kids, or they themselves have become positive. So this spike in school age cases isn't without harm. Obviously, COVID is thankfully not often a serious illness in children, but it does have other implications. And you'll see at the bottom, the orange line, that's the over 60s rate, which has been very low, and that is largely due to the vaccine program, which is really protective. It has been creeping upwards over time, and that's been leading to people having to be hospitalized, and that's possibly because of two reasons. One, it may indicate that there are some transmission from schools into families, and secondly, it may be the effect of that waning effect, which is why the booster program is so important, as we've discussed. Looking at case rates by deprivation, it's almost the opposite of what you would expect right now. So what you've got is the least deprived areas at the top having the highest rates, and the most deprived areas of Wakefield having the lowest rates currently. And we think that is largely due to testing. So there's lots of other things out there. You'll probably, quite a few of you may have had different colds and have done tests and it's come back negative for COVID. There are lots of other things out there, and we suspect that this is some underreporting of case rates in the most deprived areas as people are trying to go about their business, particularly continue to go to work. By geography, we've got every part of the district's affected, as you've probably heard before. We have a couple of hot spots, particularly around Horbury at the minute, but these come in and out. So you could come back in a week's time and Horbury will look like it's come back into the pack and somewhere else may have flared. It is because we're looking at relatively small areas. They do kind of flare up and die down quite quickly. So don't worry too much around that. The main message is it is still affecting all of our district. I'm very conscious of time. We still continue to estimate the numbers of people that will end up with long COVID symptoms, and really want to try and encourage anybody who is struggling post-COVID to make contact with services, because this is we're not necessarily seeing the numbers that we'd expect. So there is a message out there that if you are still struggling with long COVID kind of symptoms, then don't suffer in silence do make contact with health services. Onto hospital admissions. Again, that I've seen that increase, and when this report was done, we were over 100 cases in Mid Yorkshire Hospital. Actually, what we've seen this week, and hot off the press, is the numbers have come down, thankfully. So a much more stable position in terms of COVID infections in hospitals, which is very good to know. But sadly, of course, we will continue to have deaths being reported. What you can see, though, very clearly from this chart is the deaths. Whilst we are having small numbers of deaths, and that's obviously upsetting, it's nowhere near the scale that we had before. And that, again, is the vaccine program, not just helping reduce transmission, but it's helping people have a better outcome when they do get infected. That's the end of the slides. I'm not sure there's any questions.
Thank you, Steve. Does anyone have any questions about the data? I think we're all pretty used to seeing those statistics now, aren't we, guys? Yeah. Well, thank you very much, Steve, for coming and giving us that data update. I do appreciate how busy you are and all the senior management team. So thank you very much. Much appreciated. I think that we've now got Gary Jevons from Health Watch, and I believe, Gary, hopefully you're giving us a verbal update. Is that right?
Yeah, just a verbal update, and going to
Brilliant.
Be relatively quick, because I want to make sure I give you enough time for Amanda at the end of the session as well. Tracy's asked me to come and talk to you all about some funding that we received from Nova in the spring of this year. This came about because our work with Health Watch Wakefield during the various lockdowns and the pandemic meant that we worked with lots of different groups of people across the district, including some disadvantaged groups and people in the more deprived areas. We were providing information, advice and signposting about the coronavirus pandemic, as well as other aspects of health and care services. But we started to notice that there was a lack of information across the district for people that had learning disabilities, or people that find it difficult to read or write, or people with memory problems. And we wanted to do something to tackle this. Around about the same time, Nova put out a request to organisations across the district for the opportunity to get some funding from them for various topics related to helping manage the coronavirus pandemic. So we worked with Nova to get this funding and develop some easy read materials, as they're called. We commissioned Easy Read UK to create a suite of documents for us that covered various different topics, all related to COVID-19. We did some around the general rules and the general guidance around the coronavirus pandemic, and that was updated through various iterations as the national guidance was updated as well. So we did a number of documents in that realm. We also created some easy read documentation about coronavirus testing, about the vaccine program, about shielding, and about advice for people what to do when they're coming out of shielding. We had the documents created both in electronic format, which are available on our website, and I'll drop the link to that in the chat after I finish speaking. But we also got a load of printed versions as well, so I've got some here for you to see. And if I hold them up to the camera, you can see what sort of documentation we're looking at. And pages and pictures and easy read materials. The actual sort of links to the materials and some of the paper-based versions as well were sent around many different sort of stakeholders in the district, and we included the third sector leaders group, included partners from the Integrated Care Partnership, people from the Health and Wellbeing Board. We sent links and copies of the reports to Mid Yorkshire Hospitals, to the South West Yorkshire Partnership Foundation Trust, to the CCG, and to various departments within the council as well, who then each of them then sent out copies out to their networks as well. So we're fairly confident that this resource has been shared far and wide across the district. But we do still try to promote that. We've still got it up on our website. We're still been putting things out through our social media pages, and we do still have some of the paper copies available. So if you are aware of anybody that could benefit from this resource, then please do get in touch with me or one of the members of my team. I know that there's a few of them on the call today, so just drop a message in the chat and we can get back to you through that as well. And one of the other sort of knock-on effects of working in this way was that we also shared these documents with Healthwatch England, who are like the National Health Watch network, and they have now also started working with Easy Read UK through our links with this organisation to develop some national documentation as well, relating to all sorts of aspects in health and care, but in these easy read formats. And I think that's like an added benefit, knock-on effect of us doing this work with Nova. We've tried to do as much as we can, well aware that there's much more we can still do in this area. So if you've got any questions or anything that you'd be wanting to suggest to us, then please do get in touch. Thank you for your time, everyone.
Thank you very much, Gary. That's brilliant, and it's awesome that you've been able to influence nationally as well.
Yeah,
that's
a really sort of unexpected benefit to this as well. So.
Absolutely, well done. And those easy read guides are absolutely brilliant, because I've read them myself, and I know we did circulate them to our champions when they were first out, but if any champions want a reminder or any more information, as soon as Gary shares the link, it will be on the after email information that I do send out afterwards. Thank you very much. Does anyone have any questions or comments for Gary? Can't see anybody, no. So I think that might be a no, but if you do or you think about anything afterwards, please email me and we'll sort that out. Thank you very much. I noticed we've just got thank you, Gary. I've just noticed we've got a question from Pam in the chat, and it's really a key question. Let's have a look. It's just gone out of my place now. Is there any information yet on whether the medicines highlighted in the media last week are actually being made available to our hospitals and pharmacies to treat people suffering from COVID so as to mitigate the impact on the disease? That's a really good question. Actually, it was in the news, wasn't it, about a new drug that was available? So thank you for that question. Do we have anybody on the call that would like to respond to that? Steve, I think it might be over to you.
Yeah, I was just coming off mute. Yeah, I'm not precisely sure, but I will go and get an answer and come back to you. These often take time to not just to get approved, but then to ramp up the distribution and manufacture. So it may be not imminent, but I will come back to the group and get an answer on that.
Thank you very much. I'm just going to share my screen again. We did have Simon Topham was going to come and talk to you about the Benefits Road shows. Unfortunately, it's got to be elsewhere, but there's a couple of slides that I've included about the Benefits Road shows for people who might need some support with their benefits, and they're around the district. So we've got Castleford today, Kinsley and Fitzwilliam tomorrow, Pontefract on Friday, and then next week, Lupset, Nottingley, Castleford, Chapelthorpe, Havercroft, Dry Hill and Featherstone. Hopefully you've all been sent a copy of that anyway, but if you haven't or you want more information, just give me a shout and I'll send that out to you. So now we've got Amanda, who's going to talk to us about Featherstone Rovers. Over to you, Amanda.
Thank you. Hi everyone. My name's Amanda Cortman and I'm the Community Wellbeing Officer here at Featherstone Rovers Foundation. For those of you that don't know, Featherstone Rovers is a rugby club based in Featherstone. And so what we've done with our Nova grant is we've tried to communicate with our fan base around positive COVID messaging. if you're not into rugby, you might not know what kicking COVID into touch means. So when you play rugby, if you kick the ball into touch, that means you kick it out of the playing field. And so we used this as our first sort of hashtag, really, to try and engage people on Facebook and Twitter. So that's what we decided to start with. And we produced lots and lots of written material, leaflets and posters to start with. So I thought, rather than lots of boring words, I'd put some pictures up of some of the things that we did. So we put messaging around the ground. We had banners, well, we still have got banners, feather flyers, and also we had over 100 meters of bunting that we put all around the ground, so that people coming to the ground for whatever reason, whether it's visiting a shop or coming on a match day, whether they're Featherstone fans or away fans, would receive that messaging. And we use the things that Wakefield Council provided us with, so we were really grateful for that. On social media, like I say, we had our hashtag Kick COVID into Touch, and we are still putting out 2 posts a week on the foundation page, and some of those have gone over onto the club's Facebook page as well. So we have about 18,000 people that we will be seeing those messages on a weekly basis. With our leaflets, you can see there we set it up like a leaflet that would be something that would be on a match day, so people could identify with it, and it'd catch people's eyes. So it says Featherstone Rovers versus COVID. We use the players from the first team and the ladies team to sort of attract people's attention to it, and then giving out information about how we could support people to get their vaccine. So those went into, we've given out thousands. They've gone out on match days. We put them in local businesses. They went into all the bags. Anybody coming to the shop got a leaflet thrust in their hand about how we could support them, and that myself and other colleagues were available to give people advice or actual practical help for them to book the vaccines. And we've also actually physically transported about 26 people to get their vaccines and get them home again, and then provided a telephone call to just make sure that they were okay, that they weren't suffering from any side effects, and just that they sort of felt comfortable, and just knowing that they would receive that call, just to make sure they were okay. In the top corner, you can see that we produced merchandise, which I've got some examples here. So we had our little bugs that's COVID into touch with Featherstone Rovers. We had sunglasses made that say Kick COVID into touch as well. So they look fantastic. And we had backpacks made for the children and water bottles and things. So we had thousands of pieces of merchandise that we've given out on match days. I see children going to school with their PE kits in these, walking down Station Lane. So they're still using them, and it's just getting that message out. We had hand sanitizer bottles, we gave out loads, and as well it gave us that opportunity to engage with people and just say, you know, have you had your vaccines? If not, why not? And just support them with any barriers that they were facing. We worked with Millennium Care. I don't know if you can see there, some people with learning difficulties that come on a match day. The carers there were being absolutely brilliant with their people, but it was just to sort of support them if anybody needed any help or advice. So we did one special match day, which we knew that we would get a big crowd to, which was versus Toulouse. And we had over 4,000 people here at the ground. So we did something on every match day, but we pulled out all the stops on this one. So we had beer mats in the bar, we had messages on the screens in the bar. In the match day programme, there was information. The PA announcer made announcements about getting your vaccine. And the players had warm-up shirts that said keep in touch as well. And for that, we had the hashtag take the two. So when you kick for a penalty in rugby, you take the two. You take the 2 points that are on offer. So again, we were getting people to engage with us by using rugby terms. And our dancers danced with their little pom-poms to It Takes Two to Make a Thing Go Right by Rob Bass and DJ Easy Rock, which that is on YouTube, and I'll send you the link. It's so sweet, it's unbelievable. But just again, encouraging people to get the 2 vaccines. And you can see a little photo of the little dancers there, some of them as young as 3, doing a bit to promote everybody getting the COVID vaccine. And then we made it to the £1 million game, which was played in France, and this was on Sky TV, and it was also on television in New Zealand and Australia and in France as well. So the players wearing their warm-up tops were really front and centre when they were talking about the teams prior to the matches. So we got the message worldwide. So from a little town in West Yorkshire, we went global.
That's absolutely amazing, Amanda.
Yeah, and we're really proud of this project because there was a lady who I first took to have her vaccine, and her husband had died. He didn't have COVID, but her husband had died, and she was in the house and she was really scared to go out in the first lockdown. And I supported her to book her vaccine. I picked her up. We were all in PPE, both of us, windows open in the car, and I took her to the vaccine centre. She had a vaccine. I took her home. Did the phone call as well, and I received a phone call from her daughter to say that her mum was over the moon that she'd been supported, and her daughter lived in Leicestershire, and she said, you've just taken that pressure and all the worry and everything that I've had from my mum, just taking it away from me. So she was so grateful. That's really spurred me on throughout this project. So yeah, it's been great.
Wow. That's been absolutely fantastic. Thank you so much for coming to share that, because there's loads of work gone out in the background, and I'm not saying that those of you who might just be talking to 1 or 2 people or sharing with 5, that it's not a competition. It's not about saying, this is better, but what we're trying to show you here is the breadth and the depth of all the activity and all the work that's gone on from all of our partners during COVID. So thank you so much for sharing that. And I will send the link to the YouTube. That will be wonderful to watch that.
Yeah, I think as well, it's about the opportunities. So here at Featherstone, we've got an opportunity to be in touch with lots and lots of people. But if you are talking to a few people, that's just as good. We just need to get connected.
Absolutely, it is. Thank you so much. And I noticed that we've got a question from Richard, which says this is a fantastic campaign, which it is. Has it had an effect on the virus levels in Featherstone? Now, that's an interesting question for our health intelligence team, maybe. Yeah,
well, just then on the Featherstone figures, we are lower. But I did speak, Joanne Fitzpatrick, who was in charge of the vaccine programme, is a Featherstone Rovers fan, and I was talking to her, and she did say that vaccination rates in Featherstone were high. People were taking up the vaccine, but I said, well, they can't even go in a shop or stand at the bus stop or literally go to the toilet in Featherstone, because we've got posters on the back of the doors without it being in the faces, and I'm thinking, I must book that. So I know that vaccine rates were high.
Brilliant. Thank you. Steve wants to come in now.
Yeah, I mean, just to say, I love stuff like this, because and it's you never know how much of a difference it makes, but that's the real challenge of dealing with something like COVID, isn't it? But without it, it may mean that people had a worse experience, and just knowing that there's people with you and there's people helping you and there's some really good campaign stuff actually makes a difference. Even if people get infected, at least they know that there's support out there, and it's that changes how people cope with having infections as well. So it's I think it's really good stuff, and you can't look at it in isolation. You got to look at it as part of the whole package.
Yeah, thank you.
Absolutely, thank you. And I'm so pleased we've ended on such a high note. Thank you very much to all of our speakers, to all of you for dialing in and listening in, to all of our COVID champions. However much you do, it's very much valued and appreciated. Thank you to each and every one of you.